Welcome back. We're continuing on with the 10 rules of physician engagement. In this section, we're going to be talking about rules 5 and 6. So let's start with rule number 5. If you want physician engagement, then appeal to their sense of fairness and what is right for the sustainability of their practice, their service line, and even the hospital in which they practice. And we ran into this. We were looking at this was with value analysis, and we saw a product category. We're renegotiating contract, and what we found was that the vendors had a consistent increase in pricing over the previous 10 years in this product category without necessarily enhancing the quality of their product or improving the outcomes for patient care. And so this became an issue because the product was very expensive, and it's an implant, and that implant was not necessarily associated with improvements, despite the fact that the costs kept going up. Not only that, but the hospital was losing money every time one of these implants was used. And so we were thinking about centralizing the utilization of the implant. We were also thinking about just focusing on a small team who'd use it all the time, and they would focus, or they would use only one vendor. And so that was kind of, at the time, seemed fairly draconian measure to take in order to get a better pricing on particular product category. So we brought it to a group of surgeons who used this product and said, hey, first off, this is the actual price of the product. This is how much we're getting reimbursed. This is how much it's costing us every time one of these is put in. And, does this seem fair to you? Does this seem right to you? And first off, they had absolutely no idea. They didn't know what the price of it was. They didn't know that we were losing money on it. And they finally came back and said, look, this just not justified. I mean, it's a good product, but those price increases were not justified at all. And yeah, we'll support you, but we can't have you, regionalize it. This is going to destroy our practices at each of the individual facilities. And we said, well, then work with us. And they said, you know what? Yeah, of course we will. We want to maintain our practice, but also we don't want these services leaving the hospitals in which we practice. And so we sat down with them, developed a strategy around working with our vendors. We came with a cap pricing model and an all-play strategy. And lo and behold, what happened was two of the vendors walked. I said, no, we want a price increase. And they went back to the surgeons and said, you have to support us in this price increase. And the surgeons said, no way. It isn't fair. It isn't justified. And so what happened is at the 11th hour, the two vendors came back and said, we'll agree to the pricing. Again, this was a fair price. This wasn't like we were trying to lowball them or anything like that. So, when physicians can get that sense of, wait a second, this isn't fair, and we're going to help you achieve fairness in this deal, but also maintain it in a way that helps our practice and helps where we work, I think that's the way to get engagement. Again, getting back to what they value and focusing on what they value. And when you do that, you get immediate physician engagement. This one was real easy for physicians to get on board with because it appealed to all of that. And that's why rule number 5 is so important. Rule number 6, if you want physician engagement, then appeal to their interest and passion for science. And I was overseeing a surgery clinical consensus group, and we were sitting down and we were looking at reprocess energy devices and trying to get some consensus opinion around whether we should use it or we should support it or not. And we just were not getting consensus. A lot of passions on both sides of the debate. Some were very in favor of using reprocessed devices. Some were not in favor and preferred only original equipment manufacturer devices. And so debate was going back and forth. It was obvious we weren't going to get anywhere with it. And one of our more thoughtful surgeon leaders stood up and he said, hey, Terry, hey, what do you think about studying this? We've got a lot of data. Let's study it. And so it took me a while to get the data, but I eventually did, and ultimately wrote a paper on it and published it in the Journal of Medical Devices. But the idea was this, is we studied it, we looked at it, and lo and behold, what we discovered was the defect rate of the OEM, the original equipment manufacturers, was actually 4.9 times greater than reprocessed energy devices. And there's a lot of reasons why that is, and I discuss it in the paper. I also do there's another course that I put together on reprocessed devices. If you're interested, you can always go over there. I think it's only about a 30-minute course, and you can get the whole story from me straight from the data that we discovered. But what happened was physicians realized, okay, we studied it, it's our data. We're more likely to buy into not only our data, but the fact that we took the effort to go and study it. We appealed to their passion for science. and that won them over. And sure enough, we were able to convert our reprocessing rate and improve it markedly and save the organization, millions of dollars. And so that's the thing to keep in mind, and that is physicians will follow you, but if you're just gonna say do it because we're telling you to do it, maybe I'll do it, but maybe I won't. But if you're going to do it and you're telling me that we studied this and we looked at it, and what we're finding is that there's actually a higher risk with the OEM devices versus the reprocessed device, at least a higher potential risk, that gets back to quality and patient safety. And I'm more likely to follow a recommendation when I know that that's what you're appealing to. Again, getting back to what they value. So an important one for us and an important one for you. So rule number 6, you want physician engagement, appeal to their interest and passion for science. Any questions? Feel free to contact me, and we're going to move on to the next section.